Hello everybody, welcome back to my channel. Thank you for coming back. So today video is all about OSCE. I'm so sorry that it's been long. I didn't post any videos. I've been away. I was off sick with the COVID and it was awful. Anyways, I'm back. I'm trying to post videos now as soon as I can. Let's get started. As I said, my name is Saima. I'm a registered nurse from Pakistan, but currently I'm practicing in the UK. So I provide information about OET, about OSCE exams, NMC OSCE exams. I give information to help nurses, to help students to get through this journey. So let's get started. My tip number one today is about the injections, that the skills that you do in the OSCE exam. IM injections and subcut injections. So the most important thing about the injections is you need to know the difference between IM injections and subcut injections, the kind of needles you're using to withdraw the medicines, and also to know the difference that when you inject the injection, how long you need to hold it for, and then when you're going to pull the needle out. All right. And the most important thing about IM injection, as you know, that you need to take a sharp bin with you all the time. I mean, if you do injections, whether it's subcut injections or IM injections, whether you're giving insulin or whether you're giving any other heparin or other kind of stuff, so make sure you take the bin with you, sharp bin with you. If you forget to take the bin with you, what you're gonna do? Just put the sharp in your kidney tray and then transport it back to the sharp bin, but don't forget to discard it right away. Yeah. All right. And the next tip I have is always remember to check the 6 hours of medication. Check your prescription again, whether it's IM, whether it's subcut, whether it's inhaled medication or what do you call it, inhaled medication, yeah, puffs. You need to know that it's still a medicine. You need to check 6 hours of the medication, right dose, right time, right patient, all the 6 hours. Make sure you remember to check that, because, and also the safety. What we are proving to the NMC that I am a safe nurse to provide care for my patients. So you need to make sure that you don't harm the patient through the medications or any other way. If you're leaving the patient, make sure you put the bedside rail up. Yeah. Okay. So my next tip would be to prepare the skin before you inject any injection. What I mean by that, you need to prepare the skin. You need to clean the injection site with an alcohol swab. Let it dry. Okay. When it's dry, then you can give the injection. Yeah. And the other thing is, sometimes the students, they confuse insulin with other subcut injections. Remember, if you are giving insulin, it's always given at 90-degree angles. We are using a tiny needle. We're using an insulin needle to give insulin. Yeah. So make sure you give at 90-degree angle. And then if you're giving heparin, if you're giving any other subcut medications, then it will be 45-degree angles. And the other most important thing to remember is to record, to document. They say if you don't document, means you didn't do it. So make sure you do it. Make sure you document that you have given this injection, you have given this medication, your name, your print name, your signature, and the time of the medication should be there. Okay. My next tip is about ANTT, aseptic non-touch technique. So what happens if I decontaminate, or if I contaminate the area, if I contaminate the sterile trolley, what would you do? So if you touch anything by mistake or unnecessarily, so what you gonna do? Don't panic. The most important thing to remember at that point is don't panic. Just tell the assessor what went wrong and what you can do about it. Okay, if the assessor asks you to redo the trolley, just do it. Or most of the time they would say it's fine, but what would you do in the clinical setting? Just tell the examiner what would you do in the clinical setting. You need to redo the procedure. That's most important thing to remember, because sometimes what happens is students get panic, like if I contaminate the sterile field, and then they hide it. Never hide it. There are cameras there, they're assessing you all the time. So just tell the examiner. Yeah. The next point is always remember to check the expiry date of the things you're using in your dressing set, like expiry date of the gauze, alcohol swabs, and the dressing pack, all the things. Check the sterility, check the expiry, and then check if the things are visible, if they are okay in terms of expiry date, in terms of integrity, in terms of the packaging, if it's all right. Yeah, just verbalize it that I'll check for these things, and make sure you practice it when you're practicing. Sometimes if you don't practice, you will forget to do that in the exam. So make sure you practice every time. ANTT is the most important skill, which a lot of students they cannot do it in the exam properly, because they think that it's just the dressing, I can do it, I've done it many times. Whether you have done it many times, make sure you practice. Yeah. And also you need to remember that you use appropriate PPE, the way you do your PPE wearing technique, like you do your face shield, you wear your you don't need to wear face shield in the ANTT. You just need to wear your apron, you need to wear your gloves. So just follow the techniques how you're gonna wear it. And when you remove, you need to make sure that you remove gloves first, then your apron, and at the end of the procedure discard all the things that you used. Okay, sometimes what happens that sometimes students, they forget to remove the gown. Yeah, so just remember that you discard off all the things that you used. Don't leave it for somebody else. Since you are doing a dressing, when you open the dressing, you need to check, you need to state the condition of the wound. Say to the examiner, what's the condition of the wound, how it's looking, and then whether it's good or bad, and then what kind of dressing you are going to apply, and how often you're going to do the dressing again. Just verbalize it, tell it to the assessor. Yep. My next point is about catheter specimen of urine. When you take the specimen of urine, make sure you use a non-touch technique. Make sure you sterile the sampling port before you take the sample. Just clean it with alcohol swab and let it dry. And then when you pour the sample from the syringe to the container, make sure you don't touch the container with the syringe. Yeah, sometimes what happen is students, they take the sample from the balloon deflation and inflation site. So make sure you know that where is the sampling port. Yeah. Of course you do know, but in exam it happens that you get panic and then you forget what all the things going on in here. So just remember that what you're doing, be in your senses. Yeah. And also, if there is no sample in the sampling port, clamp it, wait for the sample urine to come, and then after taking the sample, unclamp it. But if there is urine in the port, you don't need to clamp it. Yeah. And then you take almost like maximum 10 mils of this urine sample. When you put it in the syringe, put it in the container, you label it at the patient bedside, and then you pack it and send it to the lab. Yep. Now, if you remove a catheter, what all the things you need to remember? You need to make sure that you wear full PPE. You need to wear your apron, you need to wear your gloves. And then don't try to manipulate with the catheter without gloves. It's important. You are touching the you're touching the secretions of the patient, urine of the patient. So make sure you wear your PPE. And also, before you remove the catheter, as you do in practice, just remember that you need to remove full amount of water that was used to inflate the balloon. Need to make sure that you have emptied the balloon before you remove the catheter. And then if it's a mannequin, it happens that you'll forget that it's a mannequin, so maybe they didn't put water. Just don't assume. Just do it as you would do it in the practice. I know you can do it. You can do it. You are nurses. And also when you remove the catheter, you need to tell the patient catheter removal complications like frequency, urgency, and they need to drink loads of water to prevent any UTI. Just do the simple guidance and education at the end of the removal of the catheter. The next point is midstream urine. I'm doing all the bits today, guys, just for you. Yeah, so if you are taking a midstream urine, remember whether your patient is male or female. Sometimes you just explain to the patient how you take a midstream urine. If it's a male, there is a different education. If it's a female, there's a different education. So just remember in the exam that your patient is female or male before you guide how to clean the urethral meatus, how to take a sample, how to clean your genitalia after taking the sample. Just remember it before you give any instruction. Just know the gender of your patient. And also when you're using the reagent strip, make sure you check the expiry date of the reagent strip, and also you need to practice it in your setting. Sometimes what happens, the strip we use in the hospital is different that they use in the OSCE centers. So make sure you familiarize yourself with the reagent strip and how to handle it. The most important thing in the midstream urine is you read the results at the appropriate time. But when it says 60 seconds, you need to wait for 60 seconds. Examiner will count the time for you, and then you're gonna do it for yourself as well. If you don't do it according to the time, it's not the way they're gonna look for it. Okay, you need to make sure if it says 15 seconds, you need to wait for 15 seconds. If it says 30 seconds, wait for 30 seconds before you read the results. That's the most important thing in urine dipstick, guys. Okay, and also you need to read the results from bottom to the top. You know that, yeah? And also when you're reading the results, make sure you read the result accurately. And because at the end of the midstream, you need to health educate the patient as well. So make sure you read the result correctly and according to the time. And because sometimes what happens is they don't give you the urine sample. Sometimes what happens is they put some sugar in it, they put some soda in it, so they do the test before you do it. So make sure you know this trick, yeah? And also, since you are handling urine, so make sure you wear your apron, you need to wear your gloves, and maintain proper hand hygiene. Any procedure you do, any procedure, make sure you do hand hygiene at the proper intervals. If you touch anything, if you're using what do you call it, peak flow meter, also if you're doing inhaled medication, any procedure, any skill, just make sure you do the hand hygiene. That's the most important thing they count on. Okay, and obviously documentation is most important in each the skill. If you're doing injections, you need to document. If you're doing assessment, you need to document, because if you don't document, you didn't do it. But since we are talking about peak flow meter, so you need to remember that you explain the procedure concisely, make it short and simple that patient would remember, and also ask the patient to tell it to you what you explained to them, just to make sure that they understand what you told them. Okay, and also documentation is most important in this section also, that if your first reading is 400, make sure you document it correctly. If first reading, second reading, third reading, and then you document in the paper provided also that how was the patient reading and what are the results and what are the health education you're gonna give about it. Yeah. Now let's talk about the inhaled medication. In the inhaled medication, you need to practice using the spacer device. It's easy. I know it's easy. You have done it many times, but again, practice again for the exam purposes. Practice it and then explain your friend. Just practice with your friend. Tell it to them. How you're going to explain it to the patient. What's the duration of the puffs, of each puff, whether it's same medication or a different medication. How many minutes, how many seconds you're going to wait. So they say if it's the same medication, you need to wait for 20 to 30 seconds. If it's a different medication, you need to wait for 2 to 5 minutes. Remember the timing. Inhalation medications, you know what those are. Those are the medications which affect directly on the patient. They inhale and the medicine go in directly into their system. So it's still a medication. Check the 6 hours of the medication, explain it to the patient, how they're gonna do it, what's the proper technique of doing the inhaled medication, and then familiarize yourself with the device and with its explanation. And also at the end, make sure you document it, that you have given this medication, you have given this education, health education about how to do the inhaled medications. Yep. I know everybody knows how to use the spacer device, how to give the puffs. Of course, you know. But for the exam purpose, remember, practice makes a man perfect. Even though you've been doing it for many years, it happens. You will forget. So with all the medications, with the inhaled medication, with the subcut medications, IM medications, you need to read the prescription carefully. As I mentioned earlier, read the 6 hours. Check if the prescription is valid and eligible. Check is the medication, dose, frequency, route. Make sure the doctor has his signature on it. So you need to make sure the prescription is valid and legible before you give any medication to the patient. That's the safety of the patient. Last but not least, we will talk about fluid balance. So in the fluid balance, you need to record accurately. You need to make sure you do the total correctly. Sometimes what they do is you just calculate all the amounts they have given, check what's their total, and then compare what you have total, the things. What have you made? Yeah, just total and write in each section provided. Never leave any section blank. They ask for your in the beginning you need to write the patient name, date of birth, and then hospital number. These are important things. And also at the end they ask for your signature and for your print name and date, and also whether it's positive balance or negative balance. Yeah, make sure you document it. It's very important. Fluid balance is the skill where you have just your papers, your calculator, and a blank sheet. So if they have provided you with the blank paper, just use it. Use the calculator. Nurses are clever. Their mind works very fast, but just use the calculator so you don't make any mistake. We don't want to make mistakes. Yeah, we just want to pass the OSCE in one go, and that's it. You don't need to do it again and again. Yeah, it's easy, guys. You know all the things. You've been practicing it for many years. You know everything, honestly. Trust me, you know everything. Just don't panic. Relax during the exam, before the exam, while you prepare, and just practice. Practice makes a man perfect. I have so many videos on OSCE, but those are the videos I recorded while I was practicing. I know they are not perfect because we were still practicing in that time, and I passed the OSCE in first go because we've been practicing all the time. I was recording. You can watch all those videos. They are really helpful. Yeah, thank you so much for being with me, guys. I hope I'll make a video soon again. I will not run away now. I'll stay with you guys, and make sure you practice, do your best for your exam, and you can do it in first go. I know that. Thank you so much. Take care. Bye bye. Have a good day ahead, guys.